Welcome back, everyone, to the Fortin Borough Corporation's Women's Symposium 2026. And just a reminder, the theme for this year is Women Impact, Powering Progress Together. And of course, this would not be possible without our sponsors, and they are National Flour Mills, AP Scott, Bride and PI, Blue Waters, and Zad and Eastman. Can we all get a round of applause for our sponsors, please? Lovely. Our next segment features women in health, and I am joined by two beautiful and very much experienced women in health, particularly women's health. I have with me Mrs. Shula Monsigi, who is a nurse and midwife, and here Miss Dr. Shonda David, gynecologist and obstetrician in the Ministry of Health. Can we get a round of applause for them, please? And those of you online, feel free to put some round of applause in the chat. Ladies, I would love to know what made you pursue the field of health.
So that's like my favorite story. Growing up, I got a lot of books as Christmas gifts. And at the age of 8, my mother gave me this book called Gifted Hands by Ben Carson. He is a neurosurgeon, and he would have grown up in a single parent home, and he speaks a lot of in the book about the things that he went through. But despite all of those things, he persevered, and he's able to be the person that he is today. And I was able to identify with a lot of the things in the story, and I felt, okay, I'm growing up in this really rural community. I'm in a single parent home, but he encouraged me, the thought of the book encouraged me to be anything that I want to be once I put my mind to it. And initially, I wanted to be a cardiologist, and I'm not even sure why particularly, but when I got to the age of 13, and I saw my menstrual cycle, I became so fascinated with the things that my body could do. And as I traversed into secondary school and into med school, by the time I got to the obstetrics and gynae rotation, it solidified the passion that I had for for me. So my desire to be an obstetrician really became out of the excitement that I had about being a female and the wonderful things that I thought my body could do. And I just love obstetrics and gynecology.
I love the idea that you had this catalyst, which, had you believe in yourself that if he in a similar situation can do this, then why not me?
Everything is possible. A lot of things. The mind is just so powerful, and everything that you can do starts with how you visualize or what you think about. And anything that you think you can do, I strongly believe that once you put your mind to it, you can definitely achieve anything.
Clock that, people. Thank you very much, Dr. David. Miss Monsegi.
Okay, for me, it started actually in primary school. I had a classmate whose mother would come in to then Fortin RC, all dressed in this white, and I always loved how this woman looked. I didn't know what job she was doing. All I know, I loved how this woman looked. So I said to myself, whatever she is, I am going to be. And as we grew older, I realized that she was a nurse. And it was so fortunate that I actually got the opportunity to work with her many years into my career. And I did share this story with her. And I said, Miss Catherine, it's because of you I am a nurse. I say, every time I see you, I just always remember. And she said, you sure you remember me? And I was able to give her the story of her coming into school, what she was dressed in, the car she used to drive, everything. It was a story that was embedded in my mind. And even, I met her after I became a midwife. And as a midwife, she was a real mentor. She was somebody who had a passion for women, a passion for births and all of that. And she was somebody who, despite our little ups and downs, formed a great impression on me and made me be who I am here today.
It's wonderful that both of you found your careers at such a very early age and pursued it. In doing so, what has been your most rewarding experience?
To be fair, in obstetrics and gynecology, every day is a rewarding experience. The opportunity to see new life or to see a life transformed just by a surgical procedure, and you go out to the public and people call you and they say, "Doc," and I'll be like, "Shh." But seeing people go, "This is your baby," or this happened and you made such an impact on my life, that makes me feel like even the days that are really, really hard and I feel like I don't want to do it anymore, hearing somebody give you a positive response, that even just a conversation that you had with them helped them, that makes all of this quite rewarding.
So you're constantly being rewarded.
Daily.
That's wonderful. Ms. Mansigi?
Indeed, it's the same thing. You know, you're walking anywhere, everywhere. Somebody pulls you up. "Nursey, look your baby." And you're like, "My baby?" And you've seen so many hundreds of faces. You cannot remember exactly who this person is. But the fact that you have made such an impression with somebody that they find you in the midst of a crowd to say to you, "Thank you," because I have so many children. Everybody comes and say, "This is your child, and this is the nurse that helped bring you here, you know. This is your child." And I'd be all over. I am literally all over. I was in Tobago, and somebody said, "Nurse, you don't remember me?" I said, "No, I don't remember you." She said, "But look, your baby." It is a continuously rewarding thing to know that somebody cares so much that I made an impression in their life that they always coming to meet you, and that supersedes anything else I have ever done in my career.
I really want to take this moment to encourage you all, because sometimes we hear some stories in the healthcare system that are not the best, but you all seem to be the persons that are really encouraging persons, making them feel welcome. In that, what are some issues that you've been seeing that there's some pressing issues that women are facing in the healthcare system?
I think when it comes to the big C, I think that's something that is really pressing. So you look at breast cancer and you have the gynecological cancers, with cervical cancer being one at the top. And a lot of these things can be done or detected through screening. So one of the things that is really important to me in every interaction that I have with patients is to stress the importance of a pap smear. And when you've gotten to the age where you can start your mammograms, because screenings, those are non-invasive, really cost-effective ways of detecting something very early that can be caught in an early stage, that when it's detected early, you have a better outcome, you have a chance of a greater survival rate. And it's important for me that women access these tools. They are available in all our health centers, they're available in the hospitals, and it's sometimes difficult to imagine that some people never had a pap smear or they never had a mammogram, and these are the things that can significantly change your life and improve your health later on. So for me, that's a pressing issue.
And as you're saying that, for persons who are looking on but don't know, when do you go for a pap smear? When do you go for a mammogram?
So a mammogram should be routinely started if you have no risk factors, meaning if you don't have a family history or you don't have a BRCA gene. It's started at the age of 40 and it's routinely done every 2 years. A pap smear is started around the age of 25 and you get a pap smear every 3 years until you get to the age of 50. And then when you get to age 50, it's every 5 years until the age of 65.
Okay, great. So I hope everyone took note of that.
I definitely hope so. It's really, really important that people utilize the things that are available to them and do the necessary things. A lot of the things of health are in our hands. And yes, I can make a difference and I can do something, but it's easier for me to help you if I've gotten something in a precancerous stage or I've gotten something at a stage 1 versus stage 3 and stage 4.
Definitely more manageable. And being proactive rather than being reactive.
Definitely.
Ms. Mansigi, what are some pressing issues you see with women's health?
I think it's about women not putting themselves first. So unfortunately, speaking as a mother myself, we tend to give ourselves or put ourselves on the back burner. So we take our health for granted. We take what's going on with us for granted. And, we put the family first, we put the husband, we put the children, we put everybody first, and we put ourselves last. And, as a result of this, things that we could have caught up early, we end up finding out late or too late. So that's my concern, that sometimes when you see women come to the hospital and they say to you, nurse, how long this has been going on, but everything else I have to do, so, and they wait until that point when there is, how do the old people put it, water more than flour, and they have no other choice and they have to come. And sometimes, unfortunately, it's too late. It's the time when the big C's have taken control and have done their done. And, the most you could do is give them support at the time. So I believe that's my main concern.
What role does emotional and mental support play in women's health?
Again, as a mother, it is important that you have support because, again, a lot of people take us for granted because we women put up a facade that I am the woman, I am the mother, I can do it. You're dying inside, you're tired, you just can't go again. But you're thinking to yourself, oh my God, the children them have to get this now, and the husband has to get this. So mental health support, emotional support, somebody to say, stop, rest yourself. I'll take it up. I'll do it. Forget the children and them, Leave the ways. I will do it. Do something. Let me take you out. Let me show you how important you are. That is so important. It's important for the woman in pregnancy. It's important for the woman out of pregnancy. And especially I want to put a plug during pregnancy time because it's already a stressful time as it is because your body is doing things that you never thought it could, that you're surprised that it's doing. And it's a lot of strain. So at that time you need somebody to say, so for the men in the room, you need somebody to rub your foot. You need somebody to rub your back. You need somebody to bring you that glass of water. You need somebody that when you go into the clinic, they come with you and they don't say that's a woman thing. They need support.
Thank you very much for sharing that, especially those practical examples that seem very simple. Now that you say it out loud. Dr. David?
I think Ms. Monsigi said a lot of it. For me, support is important because it reduces anxiety and it reduces depression. If you look, mental health is really a big thing. We're talking about how mental health is affecting your quality of life. And support just plays an important part in reducing your stress and anxiety and depression. It's so important just having somebody that you could just have a shoulder and lean on. Particularly like when I look and I have my patients in antenatal clinic and they come with their partner, you'd be surprised how many things the mommy didn't tell me that the husband was able to tell me. So it even helps me as a doctor just trying to care for them better because sometimes they are so not paying a lot of attention to some of the physical things that are happening, but the partner around them really is able to lend a support to me. So I am thinking that antenatal care, you see that the antenatal care visit tends to be a little easier with the partner, just having them around to answer some of my questions. The patient is a little more at ease. Even with ourselves, and you're with your partner. When you're with your partner, my husband says when I'm with him, my brain switches off. I automatically just feel at ease. And just as how you feel at ease when with your own partner, just think about it in that way as to how much is having support throughout your medical, that medical aspect. It really helps to ease your stress and ease your anxiety and makes the process a lot better.
As you're saying that, I'm thinking of, I have a friend who is a postpartum doula. I did not know that that existed before she told me, that's what she was studying, because, once a baby is born, everybody's baby, 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 baby. But then you have the postpartum doula who comes in and really supports the mother and makes sure that she takes care of herself and X, Y, and Z. You want to say something?
We live in an unfortunate society that after delivery, the mommy becomes non-existent. Because you would see on the wards in the hospital, when a baby is born, everybody runs.
Yes.
Baby, baby, baby. Everybody wants to see the baby. And everybody wants, oh, daddy, you're this, and mommy, you're this, and whatever. Right? And everybody wants to see baby. Nobody stops to say, mommy, how are you?
Yes.
How are you? How are you going? Most of the time you'd find is the mommy's mommy. Who says to her, how are you? But everybody else is captivated by the baby. So, sometimes they get lost in it because you feel that, everybody's expecting this of you. And it's something that we tell our mothers, even in our Lamas, because we have Lamas in our hospital. It's about yourself. Think about yourself before the pregnancy, when you plan to get pregnant. Think about what it will entail. Think about yourself during the pregnancy, and think about yourself after. Because it's so simple to lose yourself in being a mother and trying to be the perfect mother. And as I tell my mothers, nobody comes with a book. Every child is different. My experience would be different to your experience. What my child would do, your child wouldn't do. So, it's about having that there, having somebody there, having somebody to say, you want the help? You want me to take the baby? You want a minute? Yeah, that's important.
I know I was going to ask you for closing words, but this seems to solidify everything that we have discussed as well. So I'm going to ask Dr. David just to close off the panel in terms of any message that you'd love to give to women.
Which I would have said earlier, I really want to stress to women two things. One, the importance of screening. It is really important that we do these things. It helps us to detect diseases, even in the very precancerous stages, for which very simple procedures can be done. And I also want to stress on the importance of the HPV vaccine. HPV is not like HIV in terms of you could easily just go and test for it. While there are tests for HPV, it's very costly. And HPV tends to be the number one causer for cervical CA. And even if you look abroad in all the countries like UK and stuff, they're showing that they have reductions in their cervical cancer rate because of the vaccines. And I know everybody's like, well, we only push in vaccinations, but it's really about prevention, and that's what vaccination is. And the HPV vaccine is not just for your girl children, it's also for your boys, because the boys are the ones who are sleeping with the girls. So it's important. I just want to stress screening and HPV vaccines, and I think that will really help us as a society in the long run in terms of cervical CA, which is really important for me.
Excellent, ladies. Could you please give them a round of applause? We're learning so much this evening, putting yourself first, making sure that you make time for yourself, which includes the screening as well, and also being sure that we have mental and physical support from our partners, from our families, from our friends. I want to thank you all so very much for joining us this evening, and this concludes our panel on Women in Health. Stay tuned for more.